When someone's struggling with their relationship with alcohol, the advice always seems so simple, right? Just get help. But what does that actually mean? Is there one front door? A single number to call? Well, today we're going to dive into a really fascinating study that shows the reality. For so many people, the path to treatment isn't a straight line at all. It's more like a maze. And understanding that maze is the very first step to making it easier for people to find their way through. Okay, let's get into it.
So, first things first, let's just wrap our heads around the scale of this problem. In India, where this study took place, a huge analysis found that about 12.5% of people experience alcohol use disorder. That's 1 in 8. Just let that sink in for a second. That is an enormous number of people and families who might one day find themselves at the very beginning of this incredibly confusing journey. And that, right there, is the big question, isn't it? When that moment of crisis finally hits, or when a family just decides, okay, something has to change, what is step one? Well, it turns out there's not just one simple answer. The path people take actually reveals a kind of hidden logic, not just about their personal crisis, but about the entire healthcare system itself. So, to try and map these hidden pathways, researchers looked at two super different places people end up: a big, specialized tertiary care hospital and a more grassroots, community de-addiction camp. They looked at who went where, and in doing so, they basically uncovered two completely different stories about what it means to seek help. Yeah, you can really think of this like two different patient profiles. On one hand, you've got the person who shows up at the big hospital, and they're in a serious medical crisis. Their body is failing. But then you have the person who finds their way to the community camp. They're more often being driven there by a crisis at home, or maybe a problem at work. The social fabric of their life is just falling apart. And the numbers here really tell the story. If you look at the hospital group, it's all about physical emergencies. Over a third are there for what's called complicated withdrawal, which is a very serious medical situation. But at the camp, it's a totally different picture. The vast majority are dealing with uncomplicated withdrawal, and their main trigger is psychosocial problems. So you see the split, right? One group is driven by a medical crisis, the other by a social one. Okay, so we know the reasons for starting the journey are totally different. But what about the journeys themselves? What do they actually look like? Well, the researchers painstakingly mapped out every single step these patients took, and the picture that came into view is just incredibly insightful. All right, so here it is. And I know at first glance, this just looks like a total mess, right? A tangled web of arrows pointing every which way, from general doctors to specialists to hospitals. And honestly, this perfectly captures the real-world confusion that so many families have to deal with. But if you look closely, you can actually see two main highways cutting through all that noise. Let's just pull out one piece of data from that big messy map to make it super clear. Just look at this difference. It's huge. For the people who ended up at the community camp, an amazing 69% saw a psychiatrist as their very first point of contact. Their journey began with mental health. But what about the folks who landed in the specialized hospital? Only 9%. Nope. Their journey almost always started somewhere else, usually with a family doctor treating a physical problem. But hold on a second. Before we go any further, there's one number here that just stops you in your tracks. For both groups, it didn't matter which path they took. The median time from when the problem drinking started to the very first time they sought any kind of help was between 18 and 20 years. That's almost 2 decades. That's how long the silence can last before someone even takes the first step onto that complicated map we just saw. So, with a journey that's this long and this confusing, you have to wonder, who's actually making the calls? Who's in the driver's seat here, navigating the system and pushing to get care? Well, it turns out the answer really depends on which path you're on. And this is where things get really interesting. For the folks on that medical crisis path, the ones heading to the big hospital, you see this shift in control. The family might get the ball rolling, but as the medical problems get more and more serious, it's the doctors who start making the decisions. But on the other path, the one to the community camp, the family and sometimes the person themselves, they're the ones calling the shots pretty much the whole way through. But look, it doesn't matter which path someone ends up on. Let's be crystal clear about where this whole thing starts. This chart, wow, it says everything, doesn't it? In over 80% of all these cases, that first critical push to get help comes from one place: the family. They're the ones making that first phone call, booking that first appointment. They're the ones stepping into the maze. Okay, so we've mapped out these two different journeys. We know who's driving, we know what starts it all, but so what? Why does any of this actually matter in the real world?
It really boils down to this super powerful and pretty simple idea. 1. People don't just show up for help in a general sense. They're pushed by a specific crisis, either medical or social. 2. These very different needs actually create predictable, separate pathways through the health system. And 3, once you see those pathways, you realize that a one-size-fits-all approach is never going to work. We can start designing a smarter system.
I mean, at the end of the day, you can't just put up a single sign that says, get help here, and expect that to work for everyone. By seeing these hidden journeys, we can create better signposts. We can guide the person who's having a medical emergency straight to a hospital, and guide the person whose family is in crisis straight to psychosocial support. It's all about getting the right person to the right door on the very first try. And all of this leaves us with the biggest and maybe the most important question. I mean, knowing that it can take 20 years just to start this journey, how do we redesign the map? How do we untangle this path so that the next family who has to find their way doesn't have to wander around in that maze for quite so long?